Hello, my name is Anna K. Rule, and welcome back to my channel. I hope you're doing well. I wanted to discuss because I know for if you're working like a W-2 job or like a full-time job that has insurance coverage, I know that normally October is normally enrollment period for a lot of jobs. So I wanted to discuss with you a few enrollment terms to keep in mind when you're going to pick an insurance plan to either cover yourself or your family. So, copay. When the insurance says to you there's a copay, the copay is normally a fixed amount that you pay for specified health services. So, for example, primary care visits may have a different copay from emergency room visits and specialists. So, there's something to keep in mind. So, for example, you go to your doctor and you have an annual. And sometimes the doctors may not always look, and it's important to let your provider know that I'm here for an annual. So, use your words. So, if you've never been there for the entire year, let the provider you're there for an annual so they can bill under an annual because depends on what like blood work or so for doctor is doing, the insurance may not cover it or your copay may vary based on what insurance covers. So for example, primary care visits have a specific copay. If you go to emergency room, you may have a different copay as compared to other specialties. Let's say your doctor refers you to an ear, nose, and throat doctor, for example, ENT doctor. You may have a different copay for that. So it's important to know like what the copays are, and the copays also vary as well. You have to make sure you choose something in network, meaning that yeah, you may like going to like the Dr. Rule, for example, who is close to your house, but your insurance plan does not cover that provider. So it's important to call the back of your insurance card and find out what doctors or providers are in your in network because that has a lower copay as compared to others. So you want to keep in network. You want to use those providers to minimize the cost that you spend on covering for health services. And keep your receipts. Once you do copay, keep your receipts. So the insurance premium. Now, the insurance premium is the amount you pay for health insurance every month. And this amount varies if you're enrolled as an individual or as a family. Now, two things to ask here. One, when you're enrolled, you're going to show you an amount and say this is going to be your premium. Specify or ask the enrollment provider or officer or person who's enrolling you if this is per pay period or per month. So, for example, let's say you get paid weekly, or let's say you get paid twice per month, like bi-weekly, or twice per month or bi-weekly. Make sure you ask because that has caught me a few times where I saw maybe, for example, the $70, like 70 US dollars we're discussing here, and I'm thinking, okay, that is per month. When that $70 was really per pay period, which was every 2 weeks when I got paid, the insurance was taking out $70. So for the month, that amount may vary. So just ask that question. Is this amount every month or is the amount every pay period? Also, if you're enrolled as an individual versus family, the price may vary. So you can be married and you're just taking insurance for yourself because maybe your partner's insurance has different coverage or maybe based on their needs that's a better insurance for them. So you can enroll as an individual or you can enroll as a family. Now, what I normally say, to couples is that look and see which insurance has a greater benefit long term. So which one has all of these three things combined: less copay, a lower premium, a lower deductible. And you also have to consider the needs of your family. So for example, like for example, say you're thinking about dental, because I know some couples who they take medical from one partner company and the other spouse takes vision from their company because it's a different cost. Um, Always try to do medical and at least dental because one of the things is that it's recommended you do get your teeth cleaned every 6 months. So you do want to have dental, you do want to have medical. Vision, it depends on the needs, your needs. Personally, for me, I'm fortunate I haven't had a need to wear glasses, so I don't choose vision every enrollment period because enrollment period normally is every year. So I may choose it this year and I skip next year because I'm really getting my eyes checked every 2 years. So because I don't wear glasses and I don't have any complaints of vision needs. However, if you do wear glasses, then that may not be suitable for you. Or if a child or your partner wears glasses, that may not be recommended for you. So, pick the plan based on your needs and needs of your family, but also, I mean, things can happen. It could also be I don't wear glasses, but maybe that one time that year when I don't choose vision, something could happen, forbid that happen. But it's just to keep in mind the needs that you have and the needs of your family and choose whatever insurance is best for you. Deductible. So deductible is the amount of your money you must pay on covered health services before your health insurance plan begins to cover any of the cost. So what this means is that, let's say your insurance, say your deductible is $5,000, and this is like 5,000 US, for example. It means that whether it be for your if you have a procedure being covered, you may, once you get to paying over 5,000, your insurance will kick in and start paying for the coverage. So some insurance may say deductible, after you reach a deductible of $5,000, they'll cover 100% of the cost. Some say after you get to $500, they may cover 60% of the cost. So for deductible, as I said here, normal, the higher insurance premium, the lower your deductible. So I've had, for example, getting my teeth cleaned, for example, or maybe not clean, but like any special procedures, or for example, getting filling or something like that, where they may say to you, oh, your insurance company covers this amount and you have to pay this out of pocket. So as I said, for the deductible, it's important to know how much you have to pay and what your deductible is, because some insurance have some ridiculously high deductible, and you're like, you have to meet that deductible before they start covering entire expense of your health needs. So keep in mind deductibles. So write these things down. Know what deductible is, and you know yourself as well. I mean, although we can't plan for unexpected events, we can't plan for illnesses all the time. But if you find that you don't necessarily need to go to the doctor, apart from like your annual, or maybe once a year, and your annual like twice a year, for example, you may know if you need, like, how much coverage you need. But do keep in mind deductibles, because those are really a big influencer in how much you're going to pay to cover your insurance. Alrighty, so we spoke about the annual premium, we spoke about deductibles, and we spoke about co-pays. Now let me know if you have any other questions. The best person to do ask all the questions though is your enrollment advisor. And ask all the questions. I mean, no question is too silly, no question is too simple. You just want to get clarity, and write these things down so that when you actually are in front of the computer picking your enrollment plan, you know exactly what you're looking for. So in the meantime, take care of yourself so that you can care for those you love. Thank you for listening and for watching, and be well. Take care. And you can always go on your local health websites. So like, for example, I use the Center of Medicare Medicaid Services as reference for this video. Take care.